at the Global Prebiotics Association, and we're here to welcome you to the first ever Ask an Expert session for the first ever Global Prebiotics Week. Global Prebiotics Week is a celebration of everything prebiotics. It's our first ever week-long celebration, and we're really excited to continue developing the category and celebrating prebiotics. I'm delighted to be running this first session at 10 a.m. GMT, live with everyone joining us, and we have a couple more sessions throughout the day as well. So hopefully we can move on to the next slide. Just having a few issues with slides here. I'd like to introduce our panelists. I'm delighted to be joined by Len Monhai, Executive Director of GPA, and Dr. Alexander Motion, who is who are our experts. We should also be joined by Per René, who's the CEO of Clasado. And unfortunately, I think there's been some technical difficulties, and Per hasn't quite joined us yet. So hopefully he will make it with us. I will go back and do some very quick housewarming. I'm sorry for skipping over these slides. I was just trying to fill things in a little bit. I just want to give you all a very quick overview of the Global Prebiotic Association, where we are scientifically, our association is made up of scientifically validated prebiotic ingredient manufacturers, brand holders, retailers, and service companies, and we're focused on the education and awareness building of prebiotics. Our mission is to champion prebiotics by increasing public awareness and understanding of the science in both well-known and newfound benefits, and creating much-needed transparency about prebiotics and their interactions with the microbiome. We've got a wonderful group of members, and always growing, and some really great companies who support us. So a big thank you to all of our members, some of whom are joining us today. Yeah, please do get in touch if you're interested in joining the association. And as I mentioned before, our experts for this session are Dr. Alexander Motion from the Medical University of Innsbruck, Per René, CEO of Clasado, who will hopefully be joining us very soon, subject to technical issues, Len Monhai, Executive Director of the GPA, and myself, Science and Technical Director. I'm going to pass over to Len just to give himself a very quick introduction, and then to Dr. Motion, and then we'll dive into things. What I do just want to mention is just some very quick housekeeping as well. So if you are live with us, please do get involved. Please do submit questions. There's two ways of doing that. You can type in the Q&A box as quite normal in webinars. You can also use the feature to raise your hand if you do want to come live with us. If you press the raise hand feature, then we will invite you to turn on your webcam, turn on your microphone, and come and join us for a few minutes while we chat. And feel free to ask any questions that way as well. So if you do want to get involved, please do submit questions typed, or raise your hand, and we'll bring you into the conversation. Over to you, Len, to say hi.
Absolutely. Good morning, everybody, wherever, as Nathan said, you're tuning in from. My name is Len Monhai, Executive Director of the Global Prebiotic Association. We've been around for 2.5 years now, growing. We represent the category globally, the scope, Nathan, and mission that Nathan described. My own background, I've been in the industry for about 20 years, and was part of the inception of the association. Very excited about Global Prebiotics Week. I am not one of the deep technical experts, so we're going to rely on Dr. Motion and Nathan for much of that, but fascinated by the category and looking forward to this fireside chat. Thank you.
Thank you. And Dr. Motion, if you'd like to.
Good morning, everybody. So thank you very much for inviting me to this very interesting meeting today. My name is Alexander Motion. I'm from Austria. Currently, I'm full professor of medicine at the Capital University in Linz since Monday. My specialty is gastroenterology and hepatology, and I've been involved in microbiome research, particularly microbiome metabolics and microbiome immunity for many years now. That's the reason why I'm very interested in ways to impact on the microbiome to come out with health benefits for our patients. So I'm treating a lot of patients with functional gastrointestinal problems and IBD, inflammatory bowel diseases, And I'm really looking forward to that discussion today. So thanks for inviting me.
Thank you for joining us. Just a quick shout out again to all of our attendees watching live. Please do get involved and send in questions. This is an open fireside chat. It's all about asking the experts, and yeah, we want to see your questions rolling in. We've got a few already. I'm going to start by asking Dr. Motion perhaps to talk about some of the different prebiotics that he's been working with and researching. And just to talk about some of the work that he's done in that area, and maybe just a quick overview of different types of prebiotics, because I think that's always a great place to start.
So thanks for these really fascinating questions. So one thing that we're interested in is something like domestic remedies. So today we know that our grandpas and our grandmas, they had all their own recipes. Pharmacology was not that big 100 years ago, particularly within the alpine areas. And so I was quite lucky that I got in touch with Stefan Blattner von Ibrona, who are very interested in fruit extracts, and a couple of their fruit extracts, they come from plants which serve as domestic remedies, like the black elderberry. So we thought, well, we could try to set up a really scientific study to better understand how a domestic remedy translates into a medicine, into pharmacologically active substances via its interaction with the human gut microbiome. And what we currently did, and this is really interesting, is that we set up a clinical study. At the moment, we're using healthy volunteers, and we developed a special study design in which each and every study subject serves as his or her own control. And we have a lead-in phase, an intervention phase, and a washout phase. And what we do is, in parallel, we're looking for changes in the microbiome. We're looking for metabolites that metabolize these anthocyanins and these polyphenols, which is the most important content of this gut elderberry extract. And then we're looking for health effects in terms of immunological endpoints and metabolic endpoints in our patients. And we've done that with other substances before. And this is really a very exciting study because it holds the potential to get deeper into the mechanistic understanding between let's say a dietary, a prebiotic intervention and health outcomes. And for that, I think this perfectly fits with the idea of the global prebiotic week. And I'm happy to discuss more about our project.
Thank you so much. It's a fascinating area, and certainly for those of you familiar with prebiotics, you'll know that traditionally a lot of prebiotics are talked about as being sort of more on the fiber and carbohydrate side of things. We do have a mantra that certainly not all fibers are prebiotics and not all prebiotics are fibers. And there's a great amount of research emerging for things like polyphenols. So yeah, it's really exciting to have you here to talk about that. And there has been a lot of research, mostly probably in the last 10 years, I'd say. Please correct me if I'm wrong. Starting to really dig into the concept of prebiotics as polyphenols and polyphenolic ingredients as prebiotics, driving a lot of these changes. So maybe you can just sort of talk about how some of that works. I think hopefully a lot of people are quite familiar with the way that a traditional prebiotic, maybe a FOS or a GOS, is used as, for want of a better word, used as food by a bacteria in the gut and gives out some metabolites and drives changes in the microbiome. So how do polyphenols play into this?
This is a very interesting question. This is something we're really interested in. So the point is, the way how those polyphenols are processed in our body goes different ways. So part of those polyphenols, they are really absorbed along our small intestines, and they go into the liver and go into and undergo a type 1 and type 2 metabolism by the liver. And they, of course, also have their pharmacological effects, which are quite poorly defined. However, within that study, we're not so much interested in this part of polyphenols. We're more interested in how are those polyphenols metabolized by our gut microbiomes. And we've learned a lot about the gut microbiome over the last couple of years. And we know that each and every one of us harbors, well, up to 1,000 different bugs in our body. And those bugs are in our large intestine. And these bacteria, they host a lot of genes which can get involved in very complicated metabolic pathways that our body actually can't. So if we feed our microbiome and this really complex community now with polyphenols, we add a selection pressure for certain bacteria and for certain metabolic pathways that lead to expansion of certain subgroups of our microbiota, which can expand. There are very complicated mechanisms like cross-feeding and so on. And what we would like to understand is what are those kind of bugs which are going into an expansion, and what are the enzymes which are involved in the breaking down of these polyphenols, and what are the end product of those metabolic processes which are potential pharmaceutical agents which go into our bodies and have their target cells or target structure where they can work and probably transmit those ancient domestic remedy features that have been reported with those sort of drugs. And finally, and this is the end of a long story, is hopefully by understanding those mechanisms, we will be able to more specifically develop newer drugs which can help to improve preventive or even treatment strategy in the future for certain diseases. And this is, well, I'm a doctor, that's what I'm interested in. And so it's really interesting to work in that field, to work with natural products and trying to find out mechanisms and new therapeutic options for our patients later on.
Thank you. I'm gonna come to Len as well and see if he's got anything to add on the polyphenol concept as well. I think it's something that I know we've been talking about within the Prebiotic Association a little bit lately. So we've seen a lot of interest in this area, for sure.
So I have a couple questions, or maybe it's connected. One of the things I'd like to know, Dr. Moshen, is what kind of dosing are you using in sort of the clinical parameters as you are doing them right now? But then also in your sort of opening narrative, you referred to immune endpoints. What are some of those immune markers or immune endpoints that you've identified that you're potentially looking at, understanding that this may be at an early stage of the research?
So thank you very much for these very important questions. So regarding the dosing, so there is, of course, so the question is, well, is there a dose which is high enough, or is there an optimal dose? So dose finding is really an option. So the good thing is that the company Iprona, they brought in some experience in that area. And there's, of course, also some limitations, because this has to do with the extraction ratios coming from the fruit into the pure extracts, and they have a very good extraction ratio. So we have capsules with about 325 milligrams of extract, which translates into more than 20 grams of raw fruit compound, which is, I think, a reasonable amount, and we give that twice a day. So this is what we decided in our study, and this is based on data that the company had good experience with from earlier studies. But I think this is an important question, and I think this is something which has to be addressed. That's what we know from classical pharmacokinetic studies, that different persons have a different pharmacokinetics, and this might also be true for metabolic features of our microbiome, and this is clearly something that we will have a focus on. Regarding your second questions, the immunological outcomes and the parameters that we use to focus on these aspects, well, this is quite fancy because we are using healthy subjects now in the first step to address those sort of questions. What we do is a sort of targeted metabolomics, which involves metabolic and immune metabolites, now not from the microbiome, but from the host. And we deduce immunologic endpoints from innate and adaptive immunity by looking at changes before, during, and after the intervention with those specific metabolites, which gives us a quite reasonable overview of which pathways, which immunologic pathways are addressed by our intervention.
Thank you. One thing I wanted to throw out, we've had a question relating to it, and that's that we've known for a long time that obviously eating a lot of fruit and vegetables and plant compounds is great for our microbiome health and boosting diversity. And for a long time, obviously, a lot of people have been putting this down to all of the different traditional prebiotics and you know, those sort of compounds that are found in vegetable skin, that sort of thing. Is there a role that prebiotics are polyphenols are potentially having in all of this as well, given the diverse amount of polyphenols found in fruits and vegetables that people are eating? Could that be a part of that driving factor as well?
So is the question going to me or or is it going to?
I'm going to throw that to you first, Dr. Motion.
Okay. So, well, I think this is a very interesting question. There was a very interesting paper quite short a time ago. I think it was a science paper, where the researchers they followed members from the Hadza hunters and gatherers tribe over a year, and what they showed is that there are really tremendous and big changes of the microbiome during the seasonal changes within a certain area. So the microbiome looks different in the wet season compared to the dry season. And when I would like to translate this into Middle Europe, where I live, we have, of course, a very strong seasoning of the year. And we would eat, when we eat traditionally, we would eat polyphenols when they are available. And usually this would be in autumn or something like that. Now it is, so there would be certain times in the year when traditionally, from an evolutionary perspective, certain food compounds would be more available than in other seasons. And now we also have learned that the microbiome adapts very quickly to a given food supply. And by doing so, I'm very convinced that this plays an important role. But what I always ask is, because my patients often ask me, what is a healthy diet? And maybe it is the change in the diet, maybe over the seasonal change and this difference in different food supplies over the year, which gives a certain pulsatile change within the microbiome, which could have particularly good health effects. This would be an interesting area to research on, and I think this will be discussed more in the future, I'm convinced.
Len, any inputs there?
No, I think it's fascinating. I've read and I've listened to some of the research on the Hadza populations, and as one of the historical microbiome communities, they're the foundation for a lot of understanding how all these metabolomic and these interactions have evolved. So that's really fascinating. I know that we now have Per who's joined us from Clasado. But one more question. So one of the aspects of a definition of a prebiotic is its selectivity. And so that specificity, selectivity, depending on the mechanism of action, whether that's selectivity against species strain of the bugs or species or selectivity in a pathway that you've referred to. Do you anticipate or do you know whether there's any interaction with the probiotics species at strain level, or do you suspect, and is that one of the things you'll be confirming, Dr. Motion?
So, as being said, the study I was talking about is ongoing research, and I do not have any results from this study at the moment. However, I've done studies with other prebiotics, like gum, for example, which is metabolized towards short chain fatty acids predominantly, and this selectivity question has been a little bit challenged over the last years because it's a very historic definition. And with the progresses that we made in the methodology, how we look at the microbiome today, we see that things are probably a little bit more complex than we originally assumed. So what we saw, even if we give a very, I would say, a very well-defined prebiotic, we see changes in quite a lot of different members of the microbiome. So you can call this selectivity, of course, because it's still a group, but I think I'm not convinced if we can keep that sort of a very strict definition on a selective effect on one or two specific bugs for the future in the field of prebiotics. And I think this is also, there is also a lot of discussion going on with this definition. And well, what was the second part of with the probiotic bug? I can't remember. Can we repeat that, please?
Well, I think you sort of answered that in what you've just described, in that I asked whether you anticipated or knew of any specific species strain interaction that you were likely going to observe.
Yes. So I think we see specific effects. It's probably not limited to one specific group of bacteria, but it probably always involves a group of bacteria, because it's a ecological balance between those different bugs, and if you change something within that balance, well, the other groups will go up and down with the specific change that you introduce. However, I think selectivity in a broader sense of the meaning is, of course, an important definition criteria of a prebiotic.
Thank you so much, Dr. Motion. I want to bring Per René, CEO of Clasado, into the conversation. He unfortunately had some technical difficulties in joining us, but I'm delighted to welcome him to the Ask the Experts Fireside Chat now. Per, maybe you just want to spend a minute or so introducing yourself and the company, and then we'll throw a few questions your way as well, if that's okay.
Well, thank you very much for having me, and apologies for the late arrival. Well, I'm Per René, CEO of Clasado. I come from a background from the food industry for more than 20 years in raw materials. And in the last 4 years, I've been spending time in the biotech area with Pro and now with Prebiotics. Clasado is a biotech company. We developed a GOS prebiotic back in 2004. Coming from the enzyme of bifido that we synthesize our own GOS, which from a structural perspective is quite unique compared to other GOSes as well. We've done a lot of science over the years. I think we have more than 22 clinical studies, more than 90 publications is out there about our product as well. And I just want to second the words of Alexander, is that I think what we've seen over the years as well is that, yes, our GOS does predominantly feed bifidobacteria groups, but I think with the knowledge we have today as well is that you do see cross-feeding as well happening. So although we grow bifido the most, you can say, within that group, well, there's metabolites created in other bacteria groups actually utilize that as well. And I think one mention I probably want to do, that was a study done using Bimuno in a symbiotic in an obese population in the US, where they were looking to see if we could improve weight loss. And quite obviously, we didn't have an effect on weight loss or reduced BMI. But what was interesting was actually that this symbiotic actually increased the biodiversity. So there was significantly larger biodiversity in the groups that were taking a weight loss product plus this symbiotic. And I think it speaks to that as Alexander said, is that it changes the whole ecology of the microbiome when you introduce either a nutrient or another strain or two strains into the mix. So it is more complex. I think from a commercial point of view, we need to keep it simple, because that's basically what the industry and the consumer understands. But when we communicate, but I think from a science perspective, I think it's very important to recognize that it is much more complex and that there's much more that we need to know.
Thank you, Per. So we've had a question in here, which I'm going to throw out to you first, and hopefully everyone else can join in. And that's talked about the fact that often prebiotics are referred to as plant materials. You know, we're often talking about plant fibers or polyphenols, as we have been with Dr. Motion just before now. But what about some of the other prebiotics in there? I don't. It's obviously not fair to sort of say everything is a plant-based material in the prebiotic space. We've got things like HMOs. We've got some other great prebiotics around there. So maybe you can just expand on where prebiotics come from and how they're produced, and why not every prebiotic is a plant-based material.
Well, when you speak about GOSs, GOSs are produced with lactose as the raw material to enzymatic synthesis. So therefore, that does come from a milk-based source. It is predominantly the prebiotic that does come from a non-plant-based source. And I think I do see the whole food area in general, with the focus we now have on plant-based, that would increase. And I do also believe that we will start seeing more prebiotics emerging from a plant source. Not that I don't necessarily think from a prebiotic effect that there are any worse or any better. I think all the prebiotic has its own rights. But I do see the trend that we as humanity need to reduce our animal sources. That is a trend. And of course, it's not a trend that Clasado is blind to either, and of course also an area that we are exploring for future purposes as well.
And Len, I don't know whether you've got anything to add in there.
No, I'm going to just a quick comment. I think that, as Per said, I think you're seeing different upcycled ingredient trails to try to generate new plant source materials. But I think you're also seeing new other technologies that are being applied as this area increases in interest. But again, I'm not the expert that these gentlemen are.
It's a great point, though, and there's certainly you know, a lot of research out there looking at identifying novel prebiotics in the scientific literature from all sorts of waste streams, plant-based waste streams, from all sorts of traditional foods and traditional plant materials, and that's a really interesting area of research in the prebiotic space for sure. So yeah, keep an eye out on that. I think there's going to be lots of profiling studies happening in the next few years. There's already been quite a few, you know, where people are looking for prebiotic compounds that have a similar profile, I guess, to existing prebiotics, but from novel and interesting sources in the plant world. So yeah, it's an exciting area. One thing that we've asked.
Quick.
Absolutely, please do chip in. Yeah.
Yes. So you know, from a scientific perspective, so from the doctor's perspective, so another interesting way to look at prebiotics is also to reverse the way how to look at it, not to start with the prebiotics, but start to the specific metabolic function that we would like to focus on, and then look for the prebiotic that we could use to address this specific metabolic function. This is a very interesting area. And the second thing that we have learned over the last couple of years is that, well, depending on the individual constitution of the microbiome, there's tremendous differences how different patients react to a given prebiotic, which is very interesting. And well, prebiotic goes a little bit to nutrition medicine also, and I'm also responsible for that part in my department. And we are really going very strongly toward a direction of personalized nutrition, as we do in medicine in general. And I wonder if this is a chance for the prebiotic section to go for a more or to try to go for more personalized approaches in using specific prebiotics for certain patient populations. So I think this is a very interesting topic to discuss.
Absolutely agree. And this is something that GPA actually, we run a separate webinar, lasted about 60, 70 minutes on formulation, prebiotic formulation. And one of the concepts we talked about within that was this concept of smart R&D and sort of reverse engineering back from specific metabolic functions and looking for those pathways and designing your products in that way. And it's a huge area for sure. Len looked like he was going to say something there as well. So.
No, I think it's a nice segue into sort of another question, and I think that is a promising area and it's an exciting area. There's still some technologies that need to come together in order to sort of get to the diagnostics, personalization, and is it N equals 1 or is it groups of populations? Yeah, I think it's an exciting area. Is that the most exciting area that you see, Dr. Moshin? And Per, what are you looking forward to in the category? What are the challenges and obstacles that need to be overcome from your perspective, prebiotics to reach the prime time of say other nutritional and health ingredients in our space? So Dr. Moshin and then Per.
So so I always have the two perspectives. First, I'm treating patients, and I have a patient who has a problem, and I know, well, I could give so this has a functional bowel problem, let's put it like that. And I say, well, I decide to start with the fiber for my patient. And well, then I have 3, 5, 10 different options, and I have to decide what do I do. And there is no help at the moment to decide what is the right prebiotic for my patient. So we have to be pragmatic, to be honest, when it comes to clinical when it comes to clinical decision making. But we have to omit that this is also true for probiotics and other substances that we use in these areas. And being that said, I have to say, I do see the clinical need for personalization and for making better decisions. And I think besides the development and understanding of newer prebiotics, we should also work on biomarkers that help us to make treatment decisions. So that's from my medical perspective. And well, what was the second part of the question? I was talking too much, so I'm starting to getting dementia. Probably have to find a new prebiotic for that.
Well, maybe that is one of my multi-part questions. I'm sorry. The second part is, what else excites you about the promise of the category is needed to bring prebiotics to the popularity mainstream? Sort of that's the general tone of the question.
So my personal, so when I'm talking to patients and also when I'm talking to other people who are quite healthy, I think the demand for prebiotics and the demand to support personal health by nutrition, particularly by prebiotics, probiotics and other compounds, I think it's huge. So I think regarding the market, I think there should, so with the view to the companies, I think it's a huge market because there is a big trend, not only in medicine, but also in the general population to go for preventive strategies in terms of a healthy lifestyle. And well, as a doctor and as a scientist, my personal view is, well, if I give a recommendation, I want to have at least some data that are in support for that. So I think it's a very good option to go together with the clinicians, with the patients, and with the industry to generate such data. So it was really fascinating. I have to say to the study that Per was alluding to. I'm really looking forward to do so.
Same question to Per.
Well, I think what am I excited about? Well, I think being in the ingredient space for more than 20 years and been doing those 20 years, been in and out of pre and probiotics at times, if I look at purely from a you can see business, commercial, consumer point of view, what I find really exciting here is that we are on a learning path, we're on an education path to educate the consumer of the benefits that prebiotic have. As part of that, I think the possibility that quite a number of the prebiotics has a stability that you never find in a probiotic. I think that also gives versatility in the products that can be brought to market. So how can you actually get a product in front of a consumer that contains prebiotic for improvement of your gut bacteria and the impact that has on your health? That prospect is for me so much larger for a prebiotic than it actually is for a probiotics, because some of the prebiotics are heat stable, they're pH stable, so that there's not really a lot that's going to affect them. Some of course are affected, but there are that is really, really stable. So that's from a commercial point of view, and this journey of educating and bringing consumer products to the market that can help. From a science perspective, it's similar, as Dr. Motion said, is that we are this, it's almost like it's a new starting point. The more we know that we don't know, and the more we need to explore. And this reverse engineering that Dr. Motion talked to is also something that we see, is that, well, are we looking at clinical endpoints? And if we start understanding what gut bacteria can have a positive effect on those clinical endpoints, if we then understand how those bacteria break down a certain prebiotic or a certain structure, can we then start looking at how can we either create or find those structures? That's where I really see the excitement, and personally, my excitement and our interest is the latter. Is how can we work our way backwards and actually create structures for the future where we understand what is the gut bacteria actually going to do with that structure. That's what I really see is going to evolve over the next 5 to 10 years in development of targeted prebiotics.
I completely agree with that. Len, I'm going to ask that question to you as well. What excites you most?
Boy,
Throw it back at you.
Yeah, thank you. Connecting the dots. I think that there's communities that are starting to work much more closely and collaboratively together. Metabolomics technologies, big data processing technologies, seeing and the diagnostic technologies, and seeing all of those. And this is sort of the non-scientific aspect of this, but seeing those technologies and the collaborations evolve so that we can get more research done more effectively, identify some of the aspects of biodiversity, and then what does that necessarily mean? Dysbiosis, how does that impact, and getting some structure definition around dysbiosis, and then take a look at prebiotic, probably multiple ingredients to see whether we can affect dysbiosis. So I think a couple of things there. So it's a combination of technologies, then combination of prebiotic strategies I'm intrigued by. Also getting into smaller dosing units amongst the prebiotics so that the applicability is a little bit broader.
All great points. We don't have much longer left because we do have to wrap up quite soon, but we've got a few questions that I do want to deal with quite quickly, if that's okay. So the first, one of the questions that we've had in and that's as yet unanswered is asking about the use of prebiotics for skin health. I'll take the first stab at that and just say that yes, absolutely. Any area where there's a microbiome, so on our skin and our lungs, urogenital tract, mouth, oral microbiome, and of course our gut microbiome, which has been the main focus of this conversation. The prebiotic concept extends to any microbiome, essentially. And of course the research will differ, the bacteria present, the prebiotics used are different. But the concept stands, and yeah, there are certainly interesting research and products out there. Anyone got anything to add on that question? Yeah, so I think that's it's one that we could go down a whole rabbit hole and discuss for another hour on the use of prebiotics in skin health. But certainly it's an important area and a growing area of application.
Yeah, no, and I agree with that, and we do see more and more study work coming out there as well. There's more clearly animal study that has come out with prebiotics and combinations, but I do also see that there are quite a number of studies ongoing in humans as well on skin. And I think fundamentally, I don't want to play anything down from pre-pro or diet or anything, but fundamentally everything we eat fuels our body, every cell in our body. So clearly, if you are ingesting anything that has a positive effect on your gut microbiome, it will have a positive effect in your body.
Absolutely.
For me, it's very simple.
Yeah, absolutely, and that's an important point there. Obviously, that there is growing research into sort of the growing number of axes that between the gut. So we've heard a lot over the last few years about things like the gut brain axis and the links between gut microbiome and things like stress and depression and anxiety. There's certainly a lot of evidence growing for the gut skin axis, but and actually that is also another really interesting area of research. So not only have you got potential topical applications and use of direct application onto the skin microbiome and all sorts of things happening directly on the skin, but also you have that whole gut skin axis to explore for sure. Yeah. We've had a question and a comment just talking, asking us to talk about the use of prebiotic research and prebiotics to potentially increase the stability of probiotics. And so this is, I guess, tapping into that whole symbiotic concept. And of course, we talk a lot about the activity of probiotics being upregulated by prebiotics, especially if you have those synergistic combinations in a symbiotic. But is there work going on looking at sort of that stability aspect as well? And I guess we're talking in terms of delivery. There's a huge amount of issues relating to delivery of a live bacteria into the gut. So is that something that prebiotics can help with as well? Maybe.
Well, I think that is a very good question. And then, is that something it can help with? It's not something I'm going to say yes to at this moment in time, but I think there's work going on to look into it. And would there be benefits by delivering a probiotic together with a prebiotic? I think that there are evidence that is the case. And again, if you deliver the probiotic with a nutrient that it has some preference for, of course, if you put it in a capsule, that makes it a bit more acid stable, that would help as well. I think there's work looked at, can you utilize prebiotics as well as an encapsulation media? But fundamentally, again, what we have to think about is that probiotics don't like moisture, they don't like pH, and they don't like too much heat either. No, so therefore the moisture content of a prebiotic will have and the water activity will have quite a big impact on how can you utilize it. So you would have to have a prebiotic with a low water activity and moisture content to even start having the consideration: can you use it for stability and shelf life, or is it just for an increase and support of activity? So can you actually help the colonization by adding the prebiotic? And the latter, I would say yes to. I think the first one is still work to be done.
Thank you very much. We have a final question, which I'm going to throw to Len initially, and it's a bit of a potentially complicated one, but it's asking whether GPA or indeed anyone, I guess, has helped with overviewing where prebiotics have been approved, whether claims approved both in Europe and FDA. So I'm going to let you take the first stab at that, if that's okay, Len. But we will all chip in.
All right, and I'm going to start with a global perspective, then move to the U.S., and then maybe turn over to my European panelist.
Absolutely.
From a global perspective, there is no regulatory definition of a prebiotic in most jurisdictions around the world. The exception to that is currently India. It's part of their nutraceutical regulations from a couple of years ago. In most cases, the claims environment is governed by fiber claims. So it's a food-directed fiber claim environment, which is not really telling the entire story about prebiotics. So in the United States, there is No definition. There is the ability to put prebiotic on a label, which doesn't exist in other jurisdictions. The definition of a prebiotic that we use at GPA is selective, conferring a health benefit utilized within the microbiome. Those are the parameters that we look for as GPA. But certainly in the United States, there are no health claims for prebiotics. There are an entire set of health claims regarding fiber. I'll turn over for Europe and the claims environment back to my European colleagues.
I can start, or maybe Per wants to go. Sure.
Well, I think when you look at the EFSA and European health claims, that is a long-winded process that companies need to go through, and I think there is one. As far as I know, there is one. I can't remember if it's an FOS or it's an inulin that does have a health claim in Europe, and I think it's something to the effect of an increased fecal transit. Is probably in and around that kind of claim. Apart from that, I don't recall that any other prebiotic actually does have a health claim, but I might be wrong on that one.
No, you're pretty right there. So you know, the regulatory environment in Europe, as you say, is challenging, both for probiotics, prebiotics, and any other microbiome modulator. Let's put it that way. And certainly, it's been an area where we've seen a lot of challenges. I think that there's an important distinction here between approved health claims and what the research is showing. And you know that certainly there's a lot of great research out there. Some of it's emerging research that's very exciting. Some of it is very well established research, which for one reason or another hasn't yet resulted in approved claims in various regions, and that's more of a regulatory issue than a science issue. I think many would agree. But I'd just urge people to look at the science. GPA is building a database of clinical research, which will be very useful for that sort of thing. But certainly, if there are areas that that you're interested in, we can always help to point people towards the correct clinical research and towards studies, as can a lot of researchers and companies too. So that's all I'd say. Yeah, read the science, trust the science, where it's there, and question anything that doesn't have good science. And I think that is probably going to have to wrap where we are with this discussion. I'd just like to thank Len, Alexander, and Per for their time for this fireside chat. We're really delighted Per could join us for this final session, despite his technical problems. So thank you to you and to Dr. Motion in particular for your really great insights. And if you've got any sort of final points that you'd like to make, or statements that you just want to recap as the most important takeaways, if people just remember one thing, then what would that be?
Per, do you want to start?
Yep. Well, I think as you say, a takeaway would be similar to what Nathan said, is that there's a lot of great science out there. Trust the science. In different markets, there's different regulations on what you can and cannot say. I think it's a very exciting market, and I actually think any company that would not be interested in looking at prebiotic for a consumer product probably risks missing out on a trend that is really taking off now, and it is a way where you can actually add into consumer products a health ingredient that has scientific proven effects. Well, I think companies need to consider to get on that bandwagon and follow the trend.
And Dr. Motion?
So from my point of view, so from the clinical perspective again, we are using prebiotics in our daily clinical practice. So they work, and we know that they work. So I think this is put very simple. However, I think it's a very good time at the moment, because there's industry which is interested in producing new products. There is the population who demands for prebiotics because there is a health conscience, and people want to be healthier and they want to have that. We have patients who have that, and we now have the technology to go deeper into the stuff. And I think if all those parts, the patients, the industry, and maybe the researchers and the doctors, when they work together, I think we will end up with very good data, and maybe the problem with health claims and so on, well, I think they will be seen from a different perspective in a couple of years. And I'm quite convinced that this will make the whole situation better for everyone. And so I think it's a very good area to work in, and that's why we're focusing on that.
Thank you so much. Thank you, Dr. Motion. Thank you, Per. Thank you to Len as well for joining us at a very early hour for him in Chicago. And a huge thank you to everyone listening in live as well. We have been broadcasting out on Zoom, on YouTube, on Facebook, and on LinkedIn. And our videos will, of course, be available as recorded and available to watch on demand as well. Please do also remember that you can check out all of our previous webinars on the GPA website. The link was in the chat a little while ago. And just a very quick reminder that this is the first of three sessions today for our Ask the Expert panel sides. We have another one running at 10 a.m. Eastern Time US, which is 3 p.m. UK, and another one at 1 p.m. Eastern, which is 7 p.m. Here in UK. Big thank you to our guests today. Thank you to you attending. Thank you to everyone else. And we hope to see you at the next sessions. Thank you.